Hi, my name is Jillian Coljan, and I'm going to be doing my presentation on mental illness. I'd like to start off with just a couple broad facts and ideas, and then I'll talk more specifically about a couple mental illnesses and what those illnesses entail. So, to begin, I want to read the definition of mental illness according to the American Psychiatric Association, which states, a mental illness is a health condition involving changes in emotion, thinking, or behavior. They also say that mental illness is associated with distress and or problems functioning in social, work, and family activities. The statement and definition may seem very open, and they can lead to a lot of different symptoms and disorders that can fall under this category. It's kind of like an umbrella definition, which everything falls into all the specific illnesses. So a couple more facts from the American Psychiatric Association would be that nearly 1 in 5 adults, or about 19% of adults in the US, experience some form of mental illness or disorder in their lifetime. The severity of these disorders, they can vary from mild to severe, and the symptoms can range as well from person to person. However, when talking about a very serious illness, 1 in 24, or about 4.5% of adults in the US are affected from a serious or severe mental illness. While mental illness can be very severe disorder, some illnesses are treatable and contained very well with medical professional help, and the majority of people suffering can live a very normal and happy life with the proper treatment and guidance. So there are 3 main mental illnesses that I would like to get into specifics about and fully explain them. While there are a lot that could be talked about, I chose these 3 specifically because they are common, well, for the most part common, and they're just really interesting to learn about. So I plan on discussing depressive disorders, schizophrenia, and PTSD. All 3 of these disorders have a very wide range of effects, and they can vary from very mild to very severe in their symptoms and who they affect. So I'm going to begin with depression and how it affects people suffering, and also ways to get treated for depression. So again, to get a broad idea, the definition of depression or major depressive disorder, according to the American Psychiatric Association, says that depression is a serious and common medical illness that negatively affects the way you feel, the way you think, and the way you act. So depression causes feelings of sadness, worthlessness, and also a loss of interest in activities that somebody used to really enjoy or love. It can lead to not only a bad mental state, but also it can affect physical appearance as well for people who suffer. So all the symptoms of depression can have a wide range and be very different for each individual suffering from it. Some people suffering have only a very small portion of the symptoms and they're very mild, and others who have it can have almost all of the symptoms or all of the symptoms, and they can be at a very serious level, all of them. So some of the symptoms of depression, they include sad or depressed mood, which is kind of a obvious one, a loss of interest in activities that they previously enjoyed, like I said before, changes in appetite. This can be either a loss or a gain in appetite, so it can be very one or the other. Also with sleeping, trouble sleeping or sleeping too much, it can go both ways with depression. No energy or fatigue, difficulty thinking, concentrating, and also in very severe cases, thoughts of death and suicide can be symptoms of depression. So in order to be diagnosed with depression from a doctor, the symptoms need to last 2 or more weeks. In any given year, according to the American Psychiatric Association, 1 in 15 adults, or 6.7%, will be affected, and 1 in 6 people, or 16.6% of people, will experience depression in some point in their life, which is a good amount. It's one of the more common illnesses. So depression can come at any time in somebody's life, but on average, it seems to be more prominent in late teens and early 20s for people. Also, something that is interesting is that women are more likely than men to be diagnosed with depression, and some studies show that 1/3 of women will be affected by depression in some point of their life. There's not a direct cause, one specific cause of depression, and several factors can be contributed to depression, which I'm not going to get into, too much detail about this, but pretty much they include biochemistry, which is certain chemicals that make up the brain, that are in the brain that can just be off, too much of something, too little of something. Genetics, it could be passed down, it could run in families. Your personality, people with really low self-esteem or lots of stress in their life. Stress can, overwhelm people, and it can have a effect on depression. Also, the environment, people exposed to violence or abuse growing up, they're a lot more vulnerable to developing depression or the symptoms of depression because of their upbringing and environment. So treatment for depression can range as well depending on the person, but there are 3 main types of treatments, including medication, psychotherapy, and also electroconvulsion therapy, or ECT. Medication, which is probably the most common if you have a pretty moderate to severe case of depression, includes antidepressants, which can be prescribed to modify the brain chemistry and stop symptoms from happening. People taking antidepressants, they may not see their results until 2 or 3 months, and they're also advised to keep taking the medication 6 or more months even after their symptoms are gone. So it's a long process. Psychotherapy is more for mild to moderate depression, and it can aid in problem solving with the individual and also other people like family and friends who could participate in resolving the problem. Depending on severity, those sessions for psychotherapy, they can take as little as a few weeks, or they can range to a much longer date. And but in many cases, they see improvements after 10 to 15 sessions of psychotherapy. Lastly, ECT, electroconvulsion therapy, is for severe cases of depression, and it's also with patients who they have not responded to other forms of treatment. So this is electric stimulation to the brain with a patient who's under anesthesia. This usually happens 2 to 3 times a week for about 6 to 12 treatments. This is like a last resort treatment. There are many places that don't even use this strategy, and usually they go to therapies and medication before this. There's a lot of controversy with this one, but it's been around since about the 1940s, and it's made many improvements in the medical fields and the doctors using it. It's advanced a lot since 1940. So now going into schizophrenia, which is defined by the American Psychiatric Association as a chronic brain disorder and is not very common among people. So schizophrenia is very different in many aspects compared to depression. Their symptoms, treatment, how common it is, it's all very different and very unique. So schizophrenia only affects 1% of the US population, and the symptoms include delusions, hallucinations, lack of motivation, and also trouble thinking and concentrating. With treatment, most symptoms of schizophrenia will improve by a lot. However, there's no cure for this illness, so it will never fully just be gone and done with. Many people think of schizophrenic people as homeless or crazy, but the reality is that most people can get control over this illness with medical professional help, and they actually have very normal, happy lives. They have families, as long as they are smart and they control it and they do seek the help that they need. So there are several categories that the symptoms can fall into for schizophrenia. So the first category would be positive psychotic symptoms, and that includes hallucinations such as hearing voices, paranoid delusions, and exaggerated or distorted perception or beliefs. That's the first category. The second one is negative symptoms, which is a loss or decrease in the ability to make plans, speak, express emotion, find pleasure, kind of very bored, nothing going on there. Another is disorganization symptoms, which are more like confusion, disordered thinking and speech, trouble thinking logically, bizarre behaviors, abnormal movements, just a lot different than what you would normally see from people. And then the last one is impaired cognition, which is problems with attention and concentration, memory, and also it affects your educational performance, school learning, all that kind of stuff. So the symptoms for schizophrenia are usually appear in early adulthood, although men and women are equally likely to be diagnosed with schizophrenia. Men seem to show symptoms a lot earlier in like late teens, as opposed to women who don't primarily show symptoms until 20s or even as late as early 30s. So they can be very different, although they are both equally as likely to get this disorder. Diagnosing schizophrenia can be very difficult, and a full medical examination must be conducted in order to rule out any substance abuse, neurological illness, and any other disorders before they can say somebody has schizophrenia. The exact cause of schizophrenia is not certain. However, there are studies that are being done with studying genetics along with behavioral research and imaging for brain structure and function, so those are being conducted. Again, there's no cure for the treatment for this illness, and so the treatment can be very different because there is no cure. There are medications, which includes antipsychotics, that patients can take. They reduce symptoms, and they can also prevent future symptoms from worsening. And there are also therapies such as cognitive therapies and psychotherapies that can reduce the symptoms and enhance daily functioning. Other therapies that you can take, they more aim to reduce stress and support employment, and also help with social skills with those struggling, which kind of aims them in the right direction to get control over their illness. The last one I want to talk about is PTSD, or post-traumatic stress disorder, which can be defined by the American Psychiatric Association as a psychiatric disorder that can occur in people who have experienced or witnessed a traumatic event, such as a natural disaster, a serious accident, a terrorist attack, war, combat, rape, or other violent personal assaults. So PTSD is estimated to affect 3.5% of U.S. adults, and 1 in 11 people will be diagnosed with PTSD throughout their lifetime. Something interesting about PTSD is that women are twice as likely to be diagnosed than men are. So women have a much higher percentage on the diagnosing. The symptoms include really intense, disturbing thoughts and feelings related to their experience. They last long after the traumatic event has ended. They may relive the event through flashbacks or nightmares. They feel very sad, or they may be very fearful or angry. They may feel detached or, estranged from other people. People with PTSD, they might avoid situations or people that remind them of the event. They may have strong negative reactions to something super ordinary, like a loud noise, or somebody who accidentally touches them. It might strike them and be, a little trigger for them. So to be diagnosed, you must have been exposed to a traumatic event. However, there is cases where people are exposed second-handed, which means, they could be learning about a traumatic experience to a family member or somebody they were close to, and that can, cause them to actually get the PTSD themselves from just learning about it. And the symptoms of PTSD can also be put into several categories, much like schizophrenia could. So the first category is intrusive thoughts, such as repeated involuntary memories, distressing dreams, or flashbacks to the traumatic event. Avoiding reminders of the traumatic event may include avoiding people or places, activities, objects, whatever it is that bring, a distressing memory on them of the event itself. There's negative thoughts and feelings, which include ongoing or distorted beliefs about themselves or others. Also ongoing fear, horror, anger, guilt. There's a whole bunch of those ones. Loss of interest in activities that they used to love, or feeling detached. Again, Also, another category is arousal and reaction symptoms, which they might include being very irritable and having angry outbursts, being reckless, self-destructive, that kind of stuff. So there's no necessary treatment. Oh, I'm sorry. There's not always a necessary treatment for those who suffer from PTSD. Some people have their symptoms and then they slowly go away and decrease and eventually disappear over time, while others, they get it very severe and they can never fully get away from their PTSD. So there's many treatments, but I'm only going to touch upon a couple of them, just because there are so many. So one treatment is prolonged exposure therapy, which uses repeated, detailed imaging, I guess, of the trauma to cause triggers, but in a safe and controlled way to help the person control their fear and distress and learn to cope with it. So they make them, almost relive the experience, but in a safe, controlled environment, so they feel better about it and can eventually move on and realize that they are safe no matter what. Another way is medication. There's a lot of antidepressants that can be used that go with PTSD. Medication can help control the symptoms and also let people feel more safe. And also medication to help PTSD can make participants feel more safe so they can participate in psychotherapy, which is another really good way to treat PTSD. So that's about it. All of these treatments, they fall under the main umbrella defined, as I said in the very beginning about mental illness. So that is what my presentation is on, mental illness, and thank you.